This is Channel 4, and we are speaking with Dr. Aditya Bhabhe, consultant of nephrology at the Zahra Hospital, Sharjah. Doctor, tell us about chronic kidney disease. How do you diagnose it early and prevent it?
People who are at risk of developing chronic kidney disease are those with diabetes mellitus or high blood sugars, those with hypertension or high blood pressure, patients who have got other family members who have had kidney disease, patients who have had a previous kidney problem, or those who are using some medications, especially painkillers or antibiotics for a prolonged period of time, or those who have had kidney stones in the past. These people are at risk of developing kidney disease, and they should get themselves screened periodically in consultation with a nephrologist. We have to diagnose kidney disease early because in the early stages there are usually no symptoms, and symptoms start only later in the disease when more than 50% of the kidneys are damaged. So for early diagnosis, we need to screen people who are at risk of kidney disease.
And what are the signs and symptoms of kidney disease?
So signs and symptoms, like I said, initially it is a silent disease until more than 50 to 60% of the kidneys are damaged. Only when more than 50% of the kidneys are damaged, patients will have signs and symptoms like swelling over the face and feet, especially on the face when they get up in the morning. They might have complaints of weakness, getting tired easily, low energy levels. They might have poor appetite, nausea, vomiting, or shortness of breath when they walk or climb stairs, or they might have itching or decrease in urine output.
And how do you diagnose kidney disease early?
To diagnose kidney disease early, we need to do some simple tests, which include blood test, blood urea and creatinine levels. We need to do a urine test, and we need to do ultrasound of the kidneys. These 5 simple tests together will tell us whether the patient has kidney problem and how severe is the kidney problem.
What are the measures for prevention of kidney disease?
So to prevent kidney disease and to prevent patient from going into advanced kidney stage, we need to control the blood sugar of the patient. We need to control the blood pressure of the patient. We need to control the cholesterol levels of the patient. The patient needs to take a good diet which contains low salt and low proteins. Water intake should be guided as per the doctor's advice. Some patients need to increase the water intake, but in advanced kidney disease, they need to reduce the water intake. Patient has to avoid some medicines which are harmful to the kidneys, like over-the-counter painkillers or some antibiotics. And the patient has to see a nephrologist who can start medicines to control the kidney disease. These are the ways in which we can prevent the kidney disease.
And what is dialysis?
When both the kidneys are working to less than 10%, that is almost more than 90% kidneys are damaged, then the toxins start to accumulate in the body, because of which patients can have breathlessness, swelling or poor appetite. So in this case, we need to clean the blood periodically to get rid of the toxins by using a machine, and this process is called as dialysis. Dialysis, usually it is done in the hospital. The patient comes to the hospital 2 to 3 times a week as advised by the kidney doctor, and he undergoes dialysis for 4 hours 2 to 3 times a week. Whether this dialysis is temporary or permanent, that is decided by the nephrologist after seeing the patient.
Thank you so much, Doctor.
Thanks.